Now, sticking with healthcare, I'm going to hand over to Bastian now, who has very kindly said I don't have to pronounce his last name. So apologies for that, but please welcome Bastian to the stage.
Thanks. And thanks everyone for taking the time for joining us over lunch here. And I will talk to you a bit about embedding patients' lived experience into research on multiple long-term conditions. I'm part of a program that's called the AI for Multiple Long-Term Conditions, where I'm part of the research support facility, and this will all make more sense in a bit. But first, I want to talk a bit about why do we talk about multiple long-term conditions, because it's a really growing issue, because amongst people aged 65 and older, already today, over 50% of people have 2 or more health conditions, so they already have multiple long-term conditions, and 10% even have 4 or more long-term health conditions. And this is predicted to rise over the years. By 2035, it's nearly 70% and nearly 20% respectively, so it's a really growing issue. And this covers a lot of different conditions. It's both physical and mental conditions. It includes things like arthritis, respiratory disease, cancer, diabetes, but also depression, dementia, and other conditions, mental conditions. So this is really a big, big issue. And the AI for Multiple Long-Term Conditions program actually is a consortia, or a group of 8 research consortia across the UK that really work on many different aspects of multiple long-term conditions and how AI can be used to solve or at least better understand these problems. And it's a wide range of research topics, for example, understanding how do health inequalities affect people with multiple long-term conditions, how can clinical decision-making be improved for people with multiple long-term conditions, or a very concrete one, polypharmacy, because if you have that many health conditions, you're also likely to use a lot of different medications, and some of these patients are on 10 or more drugs at the same time, which then have cross-interactions with each other, which is really problematic. So in the research support facility, we support the AIM consortia for improving how they are doing research by connecting them with different stakeholders across the consortia and by really identifying and co-creating solutions to shared problems. And we do so across 5 different themes. That is reproducible and secure infrastructure. So how do we get the data? How do we make the data accessible and useful for our research? It's about community building and training, in particular for early career researchers, patient and public involvement and engagement, and sustainability and legacy for the long term. And I will talk to you about the patient involvement part in particular, which is where I'm working on as the strategic lead for. So our goals for that particular topic are to really support and empower people with lived experience. And if you've been at the Nothing About Us Without Us session this morning, you might have heard why it's really important to work with people with lived experience, because they know a lot better what happens on the ground in the healthcare system and the challenges they face than any of us could that were not affected. And this is then to really help ensure that the AIM consortia develop the best PPIE practices and implement it to make sure that the research, as far as possible, is co-created with patients with lived experience, and ensure that the research outputs themselves are also accessible and understandable to the people affected. And we do so by really engaging in a lot of community building in a very diverse community. We've actually, instead of reinventing the wheel and just doing this for the AIM consortia, been partnering up with an existing community of practice on multiple long-term conditions it's also funded by NIHR, just as the AIM consortia are, to really bring together a big and diverse group of people. And currently, we are around 150 members representing over 25 different research projects. And it's a community that brings together both researchers, clinicians, PPIE members, PPI staff, so that's the people really leading on in the individual consortia, bringing members of the public into it. And as you can see, it's really blended. It's about 40% researchers, 40% members of the public, and staff, third sector, and so on. And through our community meetings, we provide a safe space where the members of the public and the researchers can learn from each other, have discussions between these different groups, and really learn from each other. There's one very nice quote from one of our community members that really summarizes it, saying, they are a patient voice rather than an early career researcher in their case, but they really see their role in reassuring the researchers that being in contact with patients and working with patients doesn't need to be a scary thing, and that collectively they can do better research. And we hear also from the other side that this is indeed the case. And through these community buildings, we also collectively shape how we are working across the PPIE theme in the AIM RSF. So one of the things we do is we improve how PPIE is being facilitated in these consortia by actually figuring out collectively between patients and researchers, how do you best invite even for getting people come into the room? How do you facilitate online meetings that are inclusive for members of the public that might be less always online than some of us are, in particular, that given that multiple long-term conditions have like a quite different age distribution. And another thing we are currently working on is developing best practices for conference planning. How do you make sure that events like these or any events are accessible to members of the public that might have particular accessibility needs, that might have never been to a scientific conference before, things like this. So this will be out as an open source book chapter soon. And then we also co-develop training opportunities both for patients and early career researchers, depending on the needs and interests of the community. So it's not us deciding necessarily which trainings we offer, but based on the community's feedback. We've run a whole lot of trainings on how do you recruit for diverse PPAE groups to really represent the diversity of patient voices. How do you accessibly communicate so that people know what to expect from the research? And also we put accessible communication in practice by having early career researchers join us in these meetings to give presentations aimed in particular at the patient groups, explaining what is AI, what is data, to really give this like low level, like introductory talks in a way. And then we also do support the individual consortia in their own research efforts. So we do help to recruit and facilitate focus groups. We help to make outputs accessible by providing lay language summaries, by providing accessible illustrations like these, which are also then tagged with like the alternative text so people with visual disabilities can access them. So we are really working across the board to ensure that patient voices can be heard. And a very concrete example that actually we are working on with Rohan and Chris, who you just heard earlier, is on a survey on fairness in health AI, which we really want to understand which multiple long-term conditions relevant factors might make AI in healthcare particularly unfair to this group, given that they are quite particular, given the polypharmacy issues and many of the other things I've told you about. And this really came from the community initially, and we've co-developed this survey further in the community meetings and then actually ran very dedicated focus groups to really improve this research and make it useful to patient voices and make sure it fills their needs as well. And as we don't have so much time, I will leave it at that. And you can find the AIM-RSF on the first floor, stand 21. I will be there, my colleagues will be there, so you can talk to us there. Thanks.